Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Ballman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo outpatient program. Today we're talking about mood disorders, depression, and bipolar disorder. To open the discussion this time, first of all, what does depression mean?
Well, we're talking about clinical depression, obviously, not just sadness, the normal sadness that everyone feels in certain situations, but a true depression that's there more days than not, that's really taken over your life and affecting your job, your school, your relationships. Depression includes obviously feeling sad. It may affect your sleep, either sleeping too much or not enough. Affects your energy, usually not enough energy. Can affect your concentration so that you're not performing as well at work or at school.
And usually with clinical depression, people become self-critical and guilty. They may be physically slowed. They may be socially more isolated than usual. They're not pursuing or enjoying activities that they would usually enjoy in their life. And this goes on for day after day. It's not something short term, it's something that persists. And those are the cases where you have a depression disorder.
Sure. Isn't some depression normal? And what makes depression a disorder?
Well, again, it's when it's really affecting your job, your school, your relationships, your own sense of joy. It's one thing to feel sadness about certain situations that occur to all of us in life eventually, but it's quite another thing to have that feeling of sadness, that lack of joy permeate your life day after day.
And some depression is normal, and some degree of some of the symptoms that we're talking about is normal. But as Dr. Bowman was saying, it's when it becomes deeper and more persistent that it's a problem. One thing that sometimes people are not clear about with depression is that depression can come because something very difficult or stressful has happened in your life, or it can come for no apparent reason. It's a biologically based disorder often. And sometimes people think, well, of course that person's depressed. They've just gone through a divorce. But if it's become a clinical depression, it's a real clinical problem at that point, regardless of what's happened in the person's life.
So why can't someone just get over depression?
Well, because it is a clinical illness. If they could get over it, I think they would. But unfortunately, it comes to the point with some people that they just, no matter what they do, can't get that sense of involvement in life. They can't get that joy back. They may continue having problems with even motivation. It's hard to get out of bed in the morning.
It's a brain disorder when it becomes a clinical problem. And it's a little bit like saying, well, why can't that person get over their diabetes? It's not something you can will yourself out of.
How does depression get better? I don't know if you can provide some insight for us.
Well, what you want to do first is, again, as we've said with the anxiety disorders we talked about, is to talk with people, find a licensed professional to help you diagnose this, first of all, and then start looking at the options for treatment.
And in milder depression, psychotherapy alone can be a very effective treatment. When it becomes a more moderate to severe depression, psychotherapy and medication is usually the best combination.
I've got about a minute left, but I do want to cover bipolar disorder. Yeah. So what is that?
So bipolar disorder means two poles. One pole is depression and the other pole is mania. And mania is a mood state where somebody has tremendous energy, rapid thinking, less need for sleep, becomes very, very active socially and in their activities and can't slow down.
And while in the short run it may sound like, geez, I wish I had a bunch of energy and could be more interactive, it becomes destructive so that the person is not sleeping at all. They're making very impulsive, even dangerous decisions.
Sure. Got about 30 seconds. Can it be treated?
Oh, yes, very much. Bipolar disorder, in general, is treated with a combination of medication and psychotherapy.
And it's essential that it is treated, particularly if it's a more severe bipolar disorder, people will do things like spend themselves into bankruptcy in that kind of mood state. And the medications now are very effective, and there's a range of medications to choose from. So it's very important to get a good mental health professional and good treatment.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery. Tune in next week when we discuss post-traumatic stress disorder.